Hello everyone. So today I just wanted to do a brief face exam in a different setting. So first things first, if you could just take off your glasses. Okay, perfect. So now I'm going to take a look at your ears first. So if you could just turn to the right. Everything seems to be there. Everything is symmetrical. No piercings. Can you pull your ear a little bit to the side so I can see the back? Okay, you do have a mole there. Has that always been there? It has? Okay. Okay, and if you could just flip to the other side for me. Did you have a piercing in this ear at one point? Yeah? Okay. It looks like it's healed nicely. I was just wondering because I do see a little bit of an indent there. Other than that ear looks really good. So now I'm just going to take a step back and just kind of observe you overall. So it looks like you have all of the necessary body parts. Everything looks clean and dry. Do you have any complaints today that you want me to address? Your arm hurts a little bit. Okay. Which arm? That one? Okay. So did you do anything to hurt this arm, or is it sore? Is it something that's always like this? Or is this the first time you've ever noticed it? You fell playing ice hockey. Okay. Okay, if I could just pull up your sleeve a little bit to see. Okay, I don't see. Oh wait, yeah, there is one bruise there. Is that mainly where it hurts? Okay. And have you had an x-ray done on it? They said it was fine. Okay. Still uncomfortable. That sucks. What I can do is I can give you an ice pack for now if you think you might need that to continue with the exam. I can also give you an ibuprofen or a Tylenol if you think that would help. No, you're good. Okay. Okay, so let's just see what else. Your cheeks look fine. They're a little bit puffy, but in a normal way, not in any kind of concerning way. If you could just turn around for me for a second, I want to look at your hair. Okay. I am seeing just a little bit of a scab kind of towards the top of your scalp. Have you noticed that before? Oh, okay, that makes sense. I'm gonna check your hairline really quick. All right, I'm not feeling or seeing anything through there. Your neck looks good. I'm not really observing anything abnormal. You do have another kind of mole on your neck. Have you noticed that one before? Yeah, you have. Okay, it doesn't have any irregular borders and it's not a strange color, so I think you're probably okay. And now we're just going to move down your arms. So I'm just going to feel them to make sure that they don't feel super inflamed at all, except for maybe that bruised spot. Okay, so your arms seem pretty good. Like I said, it is a little warm on that bruise area. How about your fingers? Can you flip your hands over like this? Okay. Not noticing anything too odd on either hand. Okay, yeah, I think you're good there. And then I'm just going to check your eyes. So if you could just kind of keep them open for me for a second while I just see if there's any redness kind of in the eyelid line, because you can get styes there and they're really uncomfortable. I'm guessing you don't have one since you didn't mention it, but let me just check. It actually is a little red there, but I don't see the bump that's usually indicative of a sty. So it might just be irritated. Have you been like rubbing it a lot or something? Okay, you got something in your eye earlier. Okay, that makes sense. The other one looks pretty good. And looking at the skin on your face, you have a couple little spots, but they're not bad. I'm sure they'll go away in a day or two. I already looked at your hair. That looked pretty good. Your jaw is symmetrical. Your lips are symmetrical. Your nose looks fairly symmetrical. Did you have surgery on your nose by any chance? You had a deviated septum. Okay, that makes sense. All right, just continuing down to your neck area. You don't feel any lumps or bumps. The skin looks smooth and it's dry. Can you do like a range of motion test with your shoulder? So just kind of like a swimmer. Yeah, like that. And then go backwards. And same thing on the other side. And go backwards. Did you notice any pain or clicking there? You have a little bit of clicking. Is it your left shoulder? Yeah. Have you had an injury there in the past? Okay, that makes sense. So it's been dislocated several times and they did like a surgery to try and fix it, but it still kind of creaks. That makes sense. I've actually seen somebody with that before. And then I'm just going to look at your legs really quick. So if you want to put your legs straight out for me. Okay, it looks good. Both legs are symmetrical. I'm just gonna palpate them a little bit and you tell me if anything hurts. Okay, no, it seems good. And then, of course, the last thing that I would be checking is just your feet. So if you could take off your socks and shoes. Okay, perfect. Let's see. It kind of looks like you maybe have an ingrown toenail. Are you aware of that? You are? Okay. Is it really painful? Just a little bit painful. Okay. So definitely keep an eye on that because they can get much worse. I would recommend going to maybe a dermatologist to have that removed or a podiatrist potentially. And the rest of your toes look pretty good. Your nails are a little short. It's not really a problem. You just might want to let them grow out a little bit more so that they don't bleed if you cut them too short. Other foot looks good. No ingrown toenail that I can see. No like fungus or any strange growths. They just look like normal feet. So, yeah, you can probably just put your socks back on and your shoes. And then I'm going to have you flip over. Okay. So your back looks pretty normal, but you do have quite a few more moles on your back. Do you go to the dermatologist regularly? You do? Okay. And they didn't say anything about these being concerning? Okay, so they said that they were gonna watch one of them. Okay, that makes sense. Is it this one right here by any chance? Yeah, that one looks a little suspicious, but it's probably fine. And your dermatologist will, follow up with you and let you know. But other than that, it looks like the muscles in the back are symmetrical. Your shoulders look pretty symmetrical, except for that one kind of little spot where you have a scar. But other than that, I think you're good to go. Do you have any questions for me? No? Okay. So yeah, call our office if you need anything else, if you need another exam. We also have specialists here that can do specialized exams. So just let me know. And thanks for coming in. I hope you have a great day. Okay, thanks. Bye.